Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, my topic of discussion is about eye injuries. In our day to day practice, we see that many patients come to us with different types of eye injuries, and we will believe that these injuries would have been prevented had they taken proper preventive measures, especially people working in different types of professions, for example, welding, glass industry, dealing with chemicals, and all sides of construction works. When the people do not take preventive measures as far as the eye is concerned, then they develop some type of injuries, which we will discuss in the coming slides. So this is basically an informative and educational video for the general public to understand the importance of the protective gadgets. This is a patient who came to us in our emergency and he was managed. He had an eye trauma, and you can see that the cornea was cut. We call it laceration, and the cornea is stitched by interrupted sutures. Stitches have been applied, but if you see behind these stitches, you will see blood over there. Yes, and the pupil is also distorted. At 7 o'clock, you can see the brownish discoloration over there. This is the portion we call the iris of the eye, which has moved towards the one side. And so you can only see blood behind the cornea in this patient. Yes, when the last patient was operated and repaired, you can see the some part of the iris. Iris is that part brownish in some patients, and in some patients you will see it in the green or blue color. It has come out of the eye now. In spite of stitching and suturing and repairing the cornea, this portion has come out of the eyeball. So it needs again intervention to secure and fix it. The iris has been pushed back inside, and the cornea has been stitched. It is improving, healing, and you can see all those stitches suturing over there. There are more than, I think, 10 sutures at different points which have been applied. And all this happened because of the cornea was cut, and we call it a laceration, full thickness laceration. It means the whole cornea was cut and the eye is full of the blood. We don't know what's going on behind in the retina because we cannot see it over there. These things can be appreciated later on because of the ultrasound. Patient now showing the signs of improvement. Healing is going on over there, and blood is still there, settling down, but still it is all around the blood. This patient now you see at 7 o'clock position the brown iris. So after repair is healed, the first target of the physician is to save the eyeball. And once the eyeball has been saved and secured and rescued, then we will think about the vision in that eye. Yes, first target is always to save the eyeball. At 7 o'clock position, you can see the iris has moved. He will need further rehabilitation. He will need to remove the blood from the eye also, and the pupil construction, and so many other procedures needed to be done. But first, this is the condition of the improving patient with the corneal cut injury. Another patient here, you can see that the entry wound was inferiorly, so 3 stitches were applied inferiorly at you can say 5 to 7 o'clock position. There is blood inside the eye, and the patient has developed cataract. Now this white central is the normal lens have developed opacification. Now it is a cataract over there. Yes, so after improvement of this inferior wound site, this patient needs evacuation and removal of the blood as well as the cataract surgery to remove this cataract and put a new intraocular lens in the eye. Another patient who also had an injury in the eye, you can see the stitches have been applied superiorly at the upper portion of the cornea, and the patient has got cataract, whitening in the center. The lens which is naturally present has turned into the white, opacified, and there is some blood over there. So apart from the healing of the cornea, the cut, he also needs cataract surgery. Patient which the cataract surgery has been done, and new eye lens, intraocular lens have been placed into the eye. This is part of the rehabilitation. Yes, rehabilitation. Vision restoration. First, you see there are corneal interrupted sutures, stitches are there still present, which were done to save the eyeball. And now the physician has taken one step forward, and that is towards the rehabilitation or restoration of the vision. Another injury in the eye, you can see that the cut is going right through the center of the eye, and so many interrupted sutures have been applied. So after healing, it will be decided whether, because now throughout the center the incision is going, the cut is going over there. So after that it will heal, and there will be scars formed in the cornea. So it will be seen that through this scarred cornea, patient can see or he cannot see because of these scars. So if the vision is compromised and he cannot see in spite of the stitching and suturing and repair, he will most likely need corneal transplant. Yes. If the injury is so bad that the patient, in spite of repairing, he cannot see, and so much scarring has developed over it, because the reason is the cornea is just like a glass which transmits the light through it. But if it is scarred and it has got opacities and all these things, then it will not act properly as a crystal clear medium, and it has to be replaced by another donor cornea to make the transparent vision better for the patient. Another patient, kindly have a look. He has got two types of cuts, laceration. Inferiorly, lower portion you can see almost 5 stitches, and then vertical cut passing through the center almost. Center is the pupil area where the light passes through the eye and goes up to the retina. There also the sutures have been applied to secure the eyeball. Yes, there is no hyphema over there, but it needs healing. At least 6 to 8 weeks it will take to heal. And after 6 to 8 weeks, once the wound is secured, healed, these sutures are removed from there. And then the surgeon decides for the line of action. The photograph of a patient who has got corneal trauma right through the center, from top to the bottom, and it has been secured with different types of sutures, continuous, interrupted, stitches have been applied just to secure the eyeball. Yeah, this is a very severe injury cutting through the eye into the two portions, the cornea. Another horizontal injury. You can see from 3 o'clock almost it is from to the 9 o'clock, and horizontal, and behind it there is all blood. We cannot see anything behind that one. For that we have to do ultrasound to see what is the condition of the lens, what is the condition of the retina behind it, optic nerve, all these things. But right now this is all blood inside the eye. When these patients come, we first have to repair the eyeball. We have to secure the sutures and all these things. But after that, we have to do the ultrasound to see what is the condition. So this blue circle shows you that there is blood inside the eye in front of the retina. Yes, all this is blue over there circle. This is the blood. This part is called the vitreous of the eyeball, and they're all around the blood over there. Now this blood has also to be removed later on. Yes, he will need one more surgery to remove this blood. If retina is damaged, he will need a surgery for the retina also. So just imagine how many surgeries he will need. First we repair the cornea, then we will consider about the cataract surgery, and now you can also see that there is blood over there, and if retina is also damaged, then he will need a retina. Just behind this you will see the retina over there. In the ultrasound photograph, especially in the which 1, 2, 3 are shown, I have shown different parts of the eye. One is the proportion I told you, there was a blood over there. 2 is the optic nerve, the nerve which takes current, the messages from the retina, from the eye to the brain. And the 3 is the retina, where the image is formed. So any part with, for example, if as I mentioned, number 3 is damaged, it needs surgery. But if number 2 is damaged, the optic nerve which takes vision to the brain, if that is damaged, then the patient suffers great loss in the vision. Yes, sometimes irreversible. Now let's have a look at the other number 4. Again, I have shown with the arrow, there is blood inside the eye because of the trauma, because of the injury. Scan of the patient. Once, as I mentioned, some metallic thing or nail or something, broken piece, which moves with a high speed and velocity, it goes through, it cuts the eye and goes through your eye and stays in the eyeball. You can see the blue circle in the CT scan is the intraocular foreign body, IOFB. The foreign body is now inside the eye, which can be visualized because of the CT. You can see the red one is the circle, is the foreign body, the thing which has moved, metallic piece or a glass piece or a wooden piece, anything which moves with the great velocities passes through the eyeball and settles over there. Just behind is the dotted is the optic nerve. As I mentioned, it takes the messages to the brain. It also looks somewhat distorted. But if you make a comparison with the blue one, which is the normal and which is not damaged eye, here you can see the blue line is perfect. So that optic nerve has no problem over there. But in the red circle and red dotted line, you can see the foreign body, that metallic piece or whatever it is, and just behind is the dotted line, which is the optic nerve, which is damaged. Image from the CT scan from the front. Here you can see on the right side there is the foreign body, that metallic piece over there. So I have shown you the CT scan from different angles to make you understand how this foreign body has to be removed now. It is inside the eye. If not removed, it is a source of infection. It will damage the eye. It will detach the retina, and so many complications will happen. So it has to be removed. And it is removed by the retina surgeons. They do vitrectomy. They go inside the eye and then remove it. You do whatever, all these procedures, repair, restoration, patients sometimes develop infection in spite of all that. Here is an example how the infection stays in the eye. Central black arrow is the corneal infection, abscess, pus over there. And inferiorly, the blue is the pus over there that is lying over there, blue arrow. And the central is the infectious corneal ulcer or abscess, this developed. So, and see how the inflamed and red is the eyeball. So all these things can happen, the possible complications of the eye injuries, in spite of our full repair and restoration, this may happen. Patients come to me and we see over there and take the histories. This is just because these people do not use the protective gadgets. For example, so many people, when they do welding over there and they don't use the welding, these protective devices, they will get a small piece over there in the eye, and then they get it removed, and then they come again, and then they keep it removed. So ultimately you see so many opacities in their corneas, which sometimes develop infection. And particularly in this, if a metal piece goes over there and the person is not wearing these gadgets, he can have all those consequences which I showed you earlier. So it is very important for us to educate our people, inform them the importance and the significance of these protective gadgets. It is used all over in the developed world, and it should be stressed upon, and patients should be made understand, and the general public also. If people come to us for working, we should inform them that these things are very important, because eye is altogether different. Once it is damaged, in spite of repair procedures, whatever I showed you, we cannot restore the previous one. The original condition, we cannot bring it. It's very difficult. Eye is altogether a different story, a different situation as compared to other body injuries. You got a cut in the skin, you got it repaired. Anybody gets fractured, it gets repaired over there and working starts. But here, if the things are damaged over there, so such a delicate structure, the prognosis and efficiency, it's it decreases significantly. Yes, if the person's vision is, for example, 100%, if such types of traumas, it comes to 50%, 60%, 40%, but it never remains the same. So it is very important to make, for example, this is the picture I have shown you, the importance in the welding profession. So many people, young people I see whose eyes are damaged because they do not understand the importance of using the protective gadgets. Another example, construction work, hammer and chisel injuries. They are hitting some iron thing and metallic piece breaks from there and goes into eye in the speed. And the young man, people, the eyes get damaged, and which would have been prevented because of the protective gadgets. So this is construction workers, you will see chemical injuries, glass cutting injuries. All these people who are dealing with these two works, sometimes plumbers over there, they are working with the pipes, hitting them like this. And once in a while, it doesn't happen daily, but once in a while it happens and the eye is damaged. And then after that, their quality of life, their professional life, all these things are compromised. So this is another example in different professions, these things. The solution is always the same. Prevention is better than cure. These are different types of protective goggles. These are available in the market, and we should stress upon our workers and laborers who come to us for working, and general people and general public opinion, that they should teach them and tell them the importance and significance of these gadgets. Yes, these are very helpful for protecting those, as I mentioned, the small pieces of these metals, cement, chemicals, plastic or anything. When they move with such a high velocity and speed, they damage everything which comes in their way. But if somebody is putting these gadgets and he makes it a habit to use these gadgets, it is very good for them, for their protection and for their eye care. And these things, even in the training institutes, it should be stressed upon on the students who are learning different types of the skills, welding, denting, painters, automobile industries, how much it is important. Paints, who are dealing with the paints over there, they are doing it. Any chemicals management. So this is about their prevention. This is the most important solution for them. If we make them understand this importance, their eye will be saved and they will have a better quality of the life. So this video is basically for the general public to understand. This is I especially made not for the eye doctors, for the general public to understand its importance and its significance. So this message should be spread to the different people in our communities to tell them the importance of all this. I hope this video will be beneficial for our people to understand the eyes, different types of eye injuries, and how easy it is to get these prevented with simpler preventive measures. Thank you for your attendance and attention.